Okay, so did you know that only 12% of Americans are considered to be metabolically healthy? Are you in that elite 12%? Well, this is how you tell. One, you look at the criteria for metabolic syndrome. So, for those of you who don't know, metabolic syndrome is a condition or, well, a syndrome that we use to determine whether or not a patient has significant risk for coronary artery disease, for developing of diabetes, for developing cancer, and all sorts of chronic conditions. So if you do have metabolic syndrome, this places you at significant risk for these stated conditions. So the goal is to not have metabolic syndrome. So we define metabolic syndrome by 5 criteria. So the first is a fasting blood glucose greater than 30. The other is the presence of high blood pressure, which we defined as a systolic blood pressure of greater than 130, that's the top number, and or a diastolic blood pressure greater than 85, that's the bottom number. So if you have that, you can be considered to be hypertensive, and that is a marker for metabolic syndrome. The other one is abdominal obesity. So this is not so much based on your BMI, but more so on your actual waist circumference. So if you have a waist circumference greater than 40 inches for men or 35 inches for women, that is a positive marker for metabolic syndrome. The other marker for metabolic syndrome, or the other two, are actually based on your lipid panel, your cholesterol panel. So one is your triglyceride number. If your triglycerides are greater than 150, then you are considered to have that marker for metabolic syndrome. Or if your HDL, or so-called good cholesterol, is less than 50 for men or less than 40 for women. Less than 50 for women, less than 40 for men. So if you have 2 or more of these criteria, then you are considered to have metabolic syndrome. However, when they did this study, I think they defined that 12% as the segment of the population that has 1 or less than that criteria. Now, my personal or professional criteria is actually different, and it's a little bit more stringent, but it's also less complicated. And so I only utilize 2 of the markers or 2 of the criteria for metabolic syndrome, but I also add my own criteria. And so this is how I define metabolic dysfunction or metabolic health. And I think it'd be very interesting for you guys to check for yourselves, because I think it's important for your overall health and immunity and longevity. So first thing I look at is a fasting insulin. So fasting insulin level, unfortunately, is not something that is routinely ordered by most primary care physicians. So it might be something that you have to ask for specifically. But it's very important, because insulin levels are essentially what determine whether or not your cells are responding appropriately to your pancreas, which is basically a sign of insulin resistance. If your cells are not responding to the insulin being secreted by your pancreas, they're essentially resistant, or there's a beginning of insulin resistance, which is what defines metabolic dysfunction and defines the onset of diabetes mellitus. So a fasting insulin less than 5 is ideal. Anything above 5 but less than 10 is a little problematic, but I wouldn't say it's officially pre-diabetes. But any fasting insulin level greater than 10 is pre-diabetes, unless there's other reasons for that insulin level to be elevated, such as acute stress, or it wasn't a fasting level, or whatever. But your goal should be to have a fasting insulin level less than 5. This is something that you should strive for in order to feel comfortable in knowing that your metabolic function is at as prime as it could be. The other thing that I look at is the triglyceride to HDL ratio. So it is the same 2 lipid markers that are used in the criteria for metabolic syndrome, but I use them differently, because I think that just having a general cutoff number is not sufficient to really define what is going on during the metabolic process when you consider liver function and the metabolic function of the rest of the cells. So a triglyceride to HDL ratio should be 2 or less, okay? Anything above that is, again, the beginnings of metabolic dysfunction. So if you have a HDL of 50, your triglyceride should not be any higher than 100 and should actually be less. So if they are, then that is the beginnings of metabolic dysfunction and likely insulin resistance. And the reason that is because essentially when you have too high triglycerides and that are basically and not high enough HDL, you have energy imbalance and you have too much energy circulating in the system that is not getting to the proper cells, such as the liver cells, the muscle cells, or the fat cells. And so, metabolism is essentially the optimal movement and storage of energy. And so when you have the beginnings of these markers that go awry, that is the beginnings that shows the signs of energy imbalance that is occurring. And so the goal is to make sure that your energy balance is optimal. That will make your metabolism optimal. And so that should make your health also start to become optimal, okay? So instead of focusing on those 5 criteria for metabolic syndrome, just focus on these 2. Because if you get to the point where your fasting insulin is less than 5, and your triglyceride HDL ratio is less than 2, everything else will fall into place. You will see that you will no longer be hypertensive. You will see that you will probably start to lose weight and get to a healthy weight. And the abdominal circumference will improve, and your fasting blood sugar will also improve. So this is how I define proper metabolic health. This is something that I test on almost all patients in the hospital. And I have not seen anybody who has these markers where they have a fasting insulin less than 5 and they have that triglyceride to HDL ratio where it needs to be less than 2, and that they have significant chronic conditions or serious problems. The patients who I've seen who have that, which is few and far in between, especially in the hospital population, but the few that I have seen, they don't have any coronary artery disease, they don't have any high blood pressure, they have no chronic conditions. So focus on these 2 lab markers, and if you do the things necessary to get them to where they need to be, your metabolic health will be in great condition, okay? I will post something eventually with how to lower your fasting insulin level, how to improve your lipid markers, and in the meantime, do what you can to be healthy, stay safe, and let me know what you guys think. All right, thanks for watching.